afternoon to the members here. Good morning to those in the West. Once again, thank you for bringing me here. I'm called Raymond Ruyoka. I am the coordinator for Youth Advocacy and Development Network, a network of partners working with young people, not only in Uganda, but in the region. And we have, as I mentioned earlier on, we have teams in Ghana, and I'm happy to associate with you, the team there. And I know they are watching us. So, and thank you once again, Roy, for beginning a preamble, and definitely I concur with you on whatever has been shared with you from your side. I don't know if you can let me project a little of what I have.
Very well, feel free to do so.
Okay. Thank you. Just a second. Okay, I think I'm now getting there. Can you see my screen? Can you see my screen?
Yes, we can see your screen now, so you can proceed.
Okay. Thank you very much. Once again, I'm Raymond Ruyoka. I coordinate Youth Advocacy and Development Network, a network of partners working with young people in Uganda, but also we have presence in 25 countries in Africa. And I'm happy that there are more than 500 young people, advocates are watching. So I want to put my emphasis on in relation to the theme, but to my area of specialty and my profession, in relation to the theme, beyond giving a voice for young people, finding new pathways to engage young people productively. And my focus is on health. And in relation to COVID-19, I want to put my efforts into health sector, and specifically sexual reproductive health sector for young people, where is my profession. I want to talk about how it has been in Uganda, and of course, I hear it why Roy mentioned in Kenya, how the impact of COVID has affected young people there in relation to engagements. But I want to briefly about the youth sexual productive health status in Uganda and the COVID-19 pandemic and how it has affected the engagements of young people. I want to look at major gaps in the context of sexual productive health. We're talking about issues that were initially not integrated in the COVID-19 response, messaging information. At the beginning of pandemic, SRHR hadn't been integrated within the national agenda. And this brought a lot of challenges. And you later on, I will tell you that it's one of the reasons why we have the highest teenage pregnancies because of the COVID-19 in Uganda, in addition to gender-based violence. Secondly, the channel to access essential services such as protectives and condoms were not prioritized. So the exclusion of SRH for young people had an impact because of COVID-19, because government were looking at COVID-19 as the only way for getting other avenues that are impacting young people. And their sexual and protective health and rights service information were neglected. Issues of resources, both funds and health work, were either not allocated, diverted, and the social services to the COVID response. So these are one of the areas that I would think were the gaps. In addition, young people are not considered as high-risk groups, hence their needs is neglected. For us who are working in public health by profession and engagements, this was a missed opportunity. The COVID response is adult-led, and we are concerned that the young people are not put at the forefront on addressing COVID-19. Yet the impact is more with the young people, because the government Uganda has the national task force, but there are no young people on the task force. Where are the young people in this agenda? For addressing the concerns of young people, they must be put at the forefront. The focus mainly on COVID while neglecting social economic effects, and this is one of the loopholes that we have identified. Major effects of COVID-19 on young people on the SRH, I write a few effects. Of course, one is the rise in the case of teenage pregnancy and intended pregnancies. We are mentioning an increase from 30 to 50% in the new cases of teenage pregnancy in the health facilities. This is one of the cries you're having right because of COVID-19. Reduction virus suppression among young people living with HIV. The other day we are commemorating International World AIDS Day, and definitely this is one of the areas that we need to look at. That COVID-19 has made HIV a problem because government neglected HIV, and definitely the suppression those who are on drugs was an issue. Whereas in case of sexual violence against young people, that has been through defilement and incest has been one of the concerns because of COVID-19. In addition, uh, rise in mental health challenges among the young people was an issue. Vulnerability of girl child has increased since some of the SRH needs sanitary pads are not prioritized by parents because of economic effects. Because we know because of COVID, there was a reduction in the funds and poverty increase, and parents couldn't afford to buy sanitary pads for the girls, their children, and definitely they are affected because of they go into menstrual periods and their hygiene is not well catered for. The low supply of the social SRH commodities uh, because funds have been diverted. The COVID response increased the prices of the social SRH services mainly because of the supply chain have been disrupted. Think about what has been done at the country level. I told you from the concept, I'm looking at the health provider. And to me, my area is about strengthening the health concept, interventions for the young people. There have been provision of PPEs. The PPEs to peers like sanitizers, mask, gloves. Government provided these PPEs, though they are not enough. They haven't reached a number of population, but government did this, and the non-state actors supported them by procuring and providing these PPEs to the young people in Uganda. Disseminating COVID-19 related safety information that has been done, and we thank government and state actors for this. And as young people, information has been disseminated. But of course, the information is disseminated, but challenges are still there in relation to how it is disseminated. But information and about safety of COVID has been done. Protected peers continue doing one-on-one site sessions. They did a visit to young people in the communities. This has been done. Engaged teen mothers and young people on radio talk shows because of communication, because they can't move. So the focus has been on communication, strengthening communication on radio and TV, social media. All these have been done. The different partners through our networks have done innovations. So innovations have been one of the outcomes of COVID-19, that young people have been innovative enough to support their health system, support their fellow young people to be healthy, but also get away from COVID-19, get becoming victims. The Quiz Up and the Sauti Plus, all these have been done by the partners that we work with, coordinated for inclusion, advocated for inclusion of young people on the COVID-19 task force. We have pushed government to have the COVID task force have young people. It has been a tall order for us to do that, but that one has been done at district level. But the national level is still weak, but the national level is done. Our partners are doing a lot of work in relation to going to the Minister of Health with toll-free lines, doing counseling, but also addressing GBV cases. What can be done different in relation to addressing the concerns of young people, in relation to building, making them productive, but also strengthening their resilience, COVID-19? Focus more on one-on-one approach. We believe there's a need for one-on-one approach. However much, but ensuring the SOPs, standard operating procedures. We believe at this time, the lockdown had been there since February. All these months have been affected by the pandemic. We need now to have an impact by having one-on-one approach. Tomorrow group outreaches and dialogues are paramount. Strong advocate for youth-led COVID response, but also push for integrated response approach. Both COVID and SRH priorities, messaging and services. We advocate for integration of SRH in the COVID meaningfully and for the young people in relation to the messages. Documenting and widely share the effects of COVID on young people's SRHR, but also we believe is need to push for allocation of more resources to essential and life-saving sexual productive health services. We believe the focus has been much on COVID, but other areas have been neglected. We need more resources, government to allocate. But this also goes to other governments, not only to Uganda. We are calling upon African heads of state to prioritize increased resources for essential and life-saving services for young people, and including sexual reproductive health. A focus has been put much on COVID-19, but forgetting the impact, lack of sexual reproductive health services, but limited resources. Budgets have been reallocated from these health services and put on COVID-19 directly. I mentioned about mental health. I mentioned about teenage pregnancies. All of these are emanating because government are prioritizing COVID-19. We are saying heads of state in Africa should increase resources, financial resources, domestic resources, budgets to essential services, and this for young people. We need youth-friendly services to be incorporated in the COVID response. But also, most importantly, because we know COVID-19, when the victims, you must have a strong immunity. A strong nutrition is paramount. We need to look at how to empower these young people through economic empowerment, to create jobs, to have livelihood, promoting livelihood for young people, in that they can get funds, they can make startups, do business, but also strengthen their immunity through nutrition. We believe strengthening this work will help the young people survive, but also having them, the young people, as a benchmark of starting their own businesses, government supporting the innovations of young people to create jobs online, do businesses, but also promoting nutrition for them to be stronger, the immunity, and supporting them with SOPs that are very important for them. I'm just sharing the pictures of what you have done in the last engagements, engaging stakeholders in all ways. But all these are done to ensure that we strengthen collaborations. There's the need for strengthening collaborations in addressing the youth issues in the face of COVID-19, and this starts with us. COVID has told us that you can't do work alone. You can't operate in silos. We need a partnership by government, the youth councils. We are here, my colleague Roy from Kenya, the youth leaders, both political and technical, government agencies, non-state actors, development partners. They need to strengthen collaborations and partnerships to achieve our SDG 17 of partnerships, because this will help us to address COVID-19. Thank you for listening.
Thank you very, very much, Mr. Raymond Ruyoka. Mr. Raymond Ruyoka is the coordinator for the Youth Advocacy and Development Network in Uganda. And of course, as he makes the point, this is not only in Uganda, the operations are across the region. We're very grateful to you, Mr. Raymond Ruyoka, for that amazing one there. And I'm particularly excited that you throw some focus on